Welcome back. This is a before and after picture of a new filler that helps to smooth out lines around the mouth. And the best part of it is that it lasts longer than traditional treatments. Our next guest is never satisfied with the status quo. She's always looking for new and better ways to help people look and feel their best.
Dr. Deborah Manjoney is here from the Wisconsin Vein Center MediSpa with some new treatments. And in just a little bit, we've got a fun little show and tell. And you're going to get to see
it's
how big of
unbelievable.
It's phenomenal.
Our model is right here, but you got to wait a second.
She's going to wait to show you. Thanks for being
Good
here.
morning, thanks.
I'm so excited about this. I'm geeking out. But okay, let's talk first about Volbella, which is the new lip filler.
It's a new hyaluronic acid lip filler, which uses the Vicross technology that Allergan has developed to have a product that actually is going to last longer, even around the mouth, where because our mouth muscles are the most active muscles in our body, things tend to go away quicker.
Okay.
And so this may last up to a year.
Wow.
Yes.
That's much longer than what's available right now.
So to fill the lips a little bit and to fill lines around the lips, this is a great idea.
Because normal filler lasted how long?
About 3 months.
About 3 months. So you're seeing the differences there. You use a Vicross technology with that product, right? What does that mean?
That's just the structural component that holds the hyaluronic acid in place and helps it to form a nice network. So it is something that it strengthens the bonds so that it has a little bit more stability.
And I know you believe in this, but you know, the product is one thing, but who's doing it in the injector is so important.
And you know, that was very subtle in those lips, but we want it to be subtle. You know, if somebody wants to come in and have bigger lips, sure, they can talk to us about that and we can do that kind of thing. But you have to be very careful, and this product, what you see is what you get. It's not going to attract more moisture like other hyaluronic acid fillers do, so you actually see the final result immediately.
Oh, wow.
The injectors are trained, certified.
We have been trained and certified. This just became available last week. We were trained before that, and so now we have it in stock and we're using it. And that was one of our own patients that we saw the before and after with.
Since you can see the results right away, then can you in the office decide if you want more?
Yes.
Oh, see, I think that would be really helpful because a lot of times, you know, if you've got to wait a while to see the result, you don't know if you want to do something a little more. So in that moment, you can say, yeah, let's go a little more.
You can absolutely do that, but we always like to say, you know, just start a little bit less. You don't want to change the shape of your mouth so much. You just want to fill it in and make it look more youthful.
I like that. Sculpture is a brand new technology.
That's correct.
Great. You're still doing all the cool sculpting as well, but let's talk what sculpture is and how this is different.
Sculpture is a new body sculpting apparatus that uses laser technology instead of cooling in order to attain results. And so you strap on these applicators, and you can make lots of different arrangements of the applicators. So it's very customizable. And so you can do both flanks at the same time as long as they're not too big. This is all one machine, one application, and it's 25 minutes long, which is fantastic. So you do feel first you feel cooling, then you feel intense heat because the skin is cooled while further down it's being heated. So in the fat it's being heated, but the skin is being cooled. And actually when you take the applicator off, the skin still feels cold.
Oh, interesting.
But not freezing cold. It's not like what we see with CoolSculpting.
What does it do to those fat cells?
It actually destroys the fat cells. So this laser technology, as opposed to other laser technologies that have been tried in the past, actually destroys fat cells. So similar to CoolSculpting, you're going to see about a 25% reduction starting at 6 to 12 weeks. So you destroy the fat cells immediately, and they get, you know, your body kind of then washes them out over 6 to 12 weeks.
Wow.
So this is nice when people don't have a lot of pinchable fat, but they have more fibrous tissue that we can't really use an applicator like the CoolSculpting can. We love CoolSculpting. We still use it like crazy, but this is just another piece of equipment that we have to be able to offer more techniques to people who maybe aren't the right candidates for CoolSculpting.
And with CoolSculpting, especially on the abdomen, there have been patients who reported some pain for 3 to 5 days following the procedure, but you feel like things have evolved in such a way that you've kind of minimized that.
That's right. Well, CoolSculpting itself has also decreased the length of time for the treatment. So instead of an hour, it's now down to 35 minutes. So that also is really a great new advantage to being able to do that. It's called the Cool Advantage. But we have seen much less discomfort afterwards. Sometimes starting at about 3 days, you might have pain for 2 weeks. And that was nerve pain. And we're not seeing that nearly as much anymore by using these new applicators that we have with CoolSculpting as well. So either of these techniques will be much more comfortable afterwards.
Okay. Should we get to the show and tell?
Show and tell, because this is incredible. You kind of gave me a sneak peek weeks ago.
Yes.
And okay, so tell us first what you did before you show it.
Okay. I did CoolSculpting on the tricep skin fold area, the back of my arms, on one arm.
Okay.
Okay, so she only did one arm. So she's going to show you the dramatic difference in one treatment?
One treatment. Now, this is 10 weeks ago now. At 4 weeks, I could tell a
That's when you first showed it to me, right? And I could tell right away.
Yes.
Okay, so let's see. She's going to like...
We got a shot?
So this is the arm that was treated. Look at that! At the difference here. This is the arm that was not treated versus this.
So, I mean, all of us have little areas of our bodies that we're not crazy about.
A little straighter. There you go.
Here we go. So
Isn't that?
Yeah, you got to show the other one too, because you got to see them compared.
Isn't that amazing?
Show them together. There you go. Sorry, I'm not. There you go. Oh my God.
MG.
I think that's actually like right up here.
Right.
That is so distinct.
I mean, I want to, just show you. That's awful. I hate it. And this one doesn't do that.
Good for you for doing that as a way of demonstrating how it works.
Well, today I'm going to get the other one done.
If you finally know, right?
Yes. But this is one application of CoolSculpting. So it really can work tremendously. This is 20 to 25% reduction in fat, but it was in an area where I really felt so self-conscious about that. I work out 5 to 7 days a week, and still I couldn't get rid of that.
Yeah.
So this was really exciting for me.
It looks fantastic, Deb.
That's
Seriously.
awesome. I love that you did just one arm.
All right,
awesome.
So now everyone knows my secret.
I know, right?
That's
you
great,
gotta share it, right?
And this is so exciting because just for our Morning Blend viewers only, call and schedule a complimentary body contouring consultation. It's absolutely free. Buy one treatment at regular price, get one half off. This is today only though, so you got to pick up the phone, you got to make the call.
Right.
Their office is located in Pewaukee. Call right now. Be sure to mention, you have people there right now?
Yes,
okay.
absolutely.
Mention the Morning Blend when you do. It's 262-746, Tiff just picked over phone, 9088 or WIMedispa.com to find out more.
This is truly very limited, so call.
Today only. Mention the Morning Blend.
My arms, my stomach, probably a little of my sides, back of my legs, side of my legs.
Thanks,
That's good?
Debbie.
Okay.
Thank you.
Great to see you.
Great
We're all
to see you.
set, right?